Welcome to this webinar on VO2max and why it is important. Thank you for your interest. It's always interesting to know where you are watching today's broadcast from. You're very welcome to share where in the world you're joining from down in the comments below. Any questions or comments, please write it in the comment section below and we will do our best to answer them either during the broadcast or afterwards. And now, let's move on to today's agenda. We'll be covering 3 points today. What is VO2max? Why measure it? And what are the risks of having a low VO2max? To answer this as best as possible, we have Professor in Cardiology and our Chief Medical Officer, Peter Søgaard, with us today. Welcome, Peter.
Thank you, Peter, and welcome to all of you. And I'm looking forward to these following 30 minutes discussing why VO2max is important and what is actually VO2max. Most of you may know VO2max as an assessment of the functional capacity that's been performed in athletes. But actually, VO2max is also very important for all of us. And VO2max represents the maximum oxygen uptake that the body can handle and transport and consume. And VO2max is measured as the oxygen consumption in milliliters per kilogram per minute. It's important to note that there are differences between VO2max in females and males, and there's also a difference in VO2max between young and old. As the heart deteriorates in terms of filling capacity with age, VO2max declines consequently. And why is it important? That actually relates to a statement that was issued by the American Heart Association almost 10 years ago, where they claimed that VO2max was the strongest predictor of cardiovascular health, life longevity, and the risk of developing comorbidities. Unfortunately, the American Heart Association recommendation was not followed in every country for obvious reasons. It was very difficult to really perform VO2max measurements in everybody. In fact, it was impossible because at that time the known examinations were time-consuming and very costly. So that's the reason why it wasn't implemented to a great extent. But we know that even from early on in life, cardiorespiratory fitness is important. In adolescence, it's actually important because low cardiorespiratory fitness during the teenage years is associated with the greater risk of developing cardiometabolic diseases later in life. And it's also associated with how much time can you actually spend on as an active working person during the rest of your life.
Thank you, Peter. Yeah. So it's thank you for sharing, and it's clear to see that evidence-based medicine is becoming more and more pervasive, and preventive healthcare is more important than ever in a healthcare system that is facing a number of challenges, not only in the Western world, but could you say globally. On that point, can you unpack perhaps a little bit more on why we should be measuring VO2max?
Well, first of all, as I mentioned previously, it's important from early on in life because that carries, if you have a high VO2max or good cardiorespiratory fitness when you're young, the risk of developing cardiometabolic diseases during growing age is reduced, meaning we have prevented the development of disease, and by preventing development of disease, we are relieving the highly pressured healthcare system for the massive burden of disease cases. But even though you are unfit as an adult, there's also a risk that you can, or there's also a chance that you can improve. We know that from the adult situation, cardiorespiratory fitness measured as VO2max is associated with both mortality, morbidity, risk of cancer, etc., etc., and it's stronger than any other risk parameter known, such as known cardiometabolic disease, known ischemic heart disease, known hypertension, known renal disease. And there was a recent publication from the American Heart Association, the Veterans Affairs system from the US, covering 750,000 persons, where they showed that being unfit carried a greater risk than any known cardiac risk factor by itself. Do we then have to give up if we are grown up with a poor VO2max? Well, no, because the same study carried out in a subgroup of 100,000 patients clearly showed that if you have a moderate increase in cardiorespiratory fitness, you actually obtain an up to 50 to 60% reduction in cardiovascular risk and mortality within the coming 5 to 6 years. So it's not too late. There's still a chance. And it was not heavy exercise. It was actually just moderate to medium level exercise that improved these persons' cardiorespiratory fitness. It's also important to note that if you have been hospitalized with a cardiovascular condition or any condition, next slide, there is an added on benefit for the healthcare system if you improve your cardiovascular respiratory or cardiorespiratory fitness, because a recent Swedish study showed that you could see an up to 20% reduction in rehospitalizations if you improve your cardiorespiratory fitness. So it's important, not just for yourself, it's also important for society. So it puts a lower burden on the health system if we start to face the problem with people being unfit, being obese, etc., etc. So we have to work in that direction.
Thank you, Peter. And so where can the individual start, and where can perhaps we as a society start?
As a society, we have to accept that there is a problem. So we have to address the issue. And the issue is basically prevention. So basically, we have to start early in childhood. Yeah. But we have to continue. Once persons have been hospitalized, it's important that the healthcare system try to attack and improve on the rehabilitation process, which is also important because the Swedish study clearly showed that rehabilitation is also important. It's never too late to do something. Of course, it's better to start as early as possible, but it's never too late. So we have to face that issue with an increasing healthcare burden, and we can attack it throughout life with an impact on healthcare costs, but also an impact on the quality of life and life longevity for the individual person.
I think that's a very important point, that not only living long, but also living healthily. And you say cardiorespiratory fitness, quantified as VO2max, is a strong indicator of that?
Yes, it's a strong indicator of that. And, the problem today, if you really want to measure VO2max, then it's only the bicycle test with parallel measurement of oxygen uptake that can reliably provide an estimate of VO2max. The problem with that type of measurement is that it's time-consuming. It requires expensive equipment, 2-person staff to do the test, dedicated personnel to assess the test and interpret the data. It's something that takes approximately 30 minutes to complete a CPET or CPX test. And the costs reflect the complexity of the test. So the costs would, from society to society, vary from 400 to 500 euros. Since we are in Europe, we measure in euros.
Yes.
So 400 to 500 euros per test. So it's obvious that it's not something that you can,
roll out on scale.
Schedule to everybody, as stated in the American Heart Association statement, because the capacity and the costs would be, we can't solve that issue.
Limiting factors.
That is impossible. Then there are a number of other tests. There are certain running tests that you could perform. There are certain other bicycle tests that you could perform. The two-stage test or the max watt test. They are not as accurate as the CPET or CPX test. The Cooper test is also inaccurate. Obviously, many of you know the sports watches. And there are publications out there to show that the sports watches generally overestimate the VO2max in the individual person. Maybe because they don't want to embarrass you with providing too low a number. But it's not fair in terms of interpreting the data, and the variation with the sports watches is very high. So today we have an alternative to estimate VO2max by a non-exercise technology, which is the SeismoFit device. What the SeismoFit device does is that it records the vibration from the heart. When the heart contracts, when blood flows in and out of the cardiac chambers, the heart vibrates, and these vibrations are projected towards the chest and can be measured by a sensitive accelerometer. The importance is that this accelerometer has a high sampling rate, and the accelerometer is used here samples at a rate of 1,000 hertz. So it can actually provide insight into the mechanics of the heart, which is important for understanding the cardiac performance. And the cardiac performance is indeed the most important part of VO2max. So diastolic filling, or the filling of the heart, if the diastolic filling is ailing, the filling volume would go down and the stroke volume would go down and your VO2max would go down. If you have a good heart with a high filling performance, a good contractile performance, you have a high VO2max. And that's basically what the SeismoFit measures. The importance then, when you have measurements that you want to compare, is how accurate are they?
That seems especially coming from a professor such as yourself.
Yes, it's important that the measurement you are performing, the estimate that you are obtaining, reflects reliably the number that you present to your patient for predicting this patient's risk. So we know from literature that MAPE is an important component to measure. MAPE means the mean absolute percentage error. And for a system to have a reliable prediction of a number, so that the prediction actually reflects the risk associated with this number, the MAPE has to be below 10. So we know that the CPET is not 100% predictive. It has a MAPE of close to 5%. The SeismoFit system has a MAPE of 8.2% in a very recent publication with updated software, the most recent software, because this is a software tool that analyzes these vibrations in a cloud solution.
Yes.
So with the updated software versions, size per fit is around 8% in MAPE. And for comparison, the sports watches has a MAPE of 14%. It's also important to note that the sports watches are not an approved medical device. Like the size per fit is, it's an approved medical device, it's CE marked. But sports watches are not medical devices.
Yes.
Some of the other exercise tests, like the Watt test and the two-stage test, also have a MAPE that's way above 10%.
Thank you, Peter. One question that springs to mind when you share these points on exercise and training and what can be done. Measuring VO2 max, what is your observations as a professor that the knowledge of one's VO2 max, do you see it has on behavior or focus on changing this?
That's a very good question. The majority of the people that I have tested with the device who had a low VO2 max were shocked. Because I don't think people actually consider this. And that's maybe what we have to change. And that might be the reason why we're facing an epidemic of obesity, etc., in the community. Because people are not aware, they're not thinking about this. So we have to change people's mindset, but we also have to change the healthcare system's approach to what we are doing. We have to go more into prevention. We have to start early. We have to encourage the kids to go to sports instead of playing video games. Because if those who are to follow me, because I have an expiration date regardless of my VO2 max, but for those to follow me, if we should have a workforce that can continue to stimulate our growth and wealth and maintain our wealth, they have to be fit.
Yes.
From very early on. That's very important. You have to think about that. But we also have to change the mindset. And I think that a lot of the people that are grown up today, they don't have the mindset yet that it's important. No, I don't think so.
I guess it's very much this old saying that if it can't be measured, then what can you do about it? Is that what has been plaguing VO2 max in the past?
Yes, because you haven't been able to measure it for obvious reasons.
Yes.
But now you can measure it. It actually takes 3 minutes with the person at rest. So you don't have to dress up. You don't have to show up in fancy outfit to have a size per fit measurement. You don't have to sweat in the gym with the rest of the people. You should sweat in the gym, of course, between your measurements. That's right. Or you should at least walk or bike during your everyday life to improve on your VO2 max. But for the measurement, it's very simple. It takes 3 minutes at rest, and it's cheap. The price is around 12, 15 euros, depending on how many measurements is performed. So it's a cheap and it's a fast measurement. You have the response, you have the answer to your VO2 max within 3 minutes from the onset of the measurement.
And I know, Peter, that one thing that is very important to you as a professor is, of course, the research and the statistical significance of this parameter, this biomarker that VO2 max is. And that's why you brought in with us this specific meta-analysis.
Just recently published, yes. It actually covers a search of 10,000 papers.
Nearly 10,000, yes.
Nearly 10,000 papers. So there's massive evidence out there to suggest that VO2 max is important. There's massive evidence to suggest that it affects your life longevity, risk of suffering comorbidities during your life. But it also has an impact not just on cardiovascular, it also has an impact on the risk of cancer. It has an impact on your cognitive function. So you're able to concentrate and focus more during your everyday work life if your cardiorespiratory fitness is high. So it's not just all of the physical, there's also a series of mental benefits associated with having a high VO2max.
Yes.
So that's very important. I would strongly encourage all of you out there, if you're not physically active during everyday life, to try and change that attitude. And if you're unfit, it's also important that you don't start out by exercising too heavily, because even moderate activity level changes or activity level increases during everyday life can have an impact on your VO2max. So it's important that you don't stress yourself by being too aggressive and say, ooh, this is really bad, I have to do something about it. No, you can actually start quietly and then build on that. And as long as you're working in the right direction, you improve on your own risk. You improve on your comorbidities and being hospitalized, etc., etc.
Yes, and that's also one part of this study is actually the researchers behind it. They say that anything is really more significant than nothing. They call it one at a time. That's so you can say that as easy as it can be done.
Yes. And it's also important, you know, if you'd say, but what's the span from being unfit to being fit? From the Veterans Affairs study covering 750,000 included in that study, that's a substantial single study. They showed that if you were least fit compared to best fit, you had an almost 5 times increased risk of dying within a 10-year time frame from the measurement, regardless of age.
That's scary.
And across age, race, sex, it was the strongest predictor of outcome. And another thing which is important to mention also was that extreme fitness was not associated with excessive risk in any ways. So being extreme fit is very good.
Yes.
There's no risk being associated with being extremely fit.
That
was also highlighted from this study. And on the short term, you can do something to improve on your prognosis. And right now, we have the tools to measure without any previous knowledge on you as a person. You can have your VO2max estimated within 3 minutes at an inexpensive rate.
Yes. And also to the point from before on how you rank the level of fitness. Also, I know that you've been following very closely the study of Kyle Mansager, his 2018 study, where he has these different levels. So, what would you say is the significance of just taking one step up that ladder from low to medium to high to very high?
Well, it's nice to use again the American study. It shows that if you have a moderate improvement, you reduce your risk of dying within 3 to 4 years by 60%.
60%?
That's substantial.
And when it comes from a professor of cardiology, it's...
That's a substantial benefit.
We ought to listen.
Yes, we have to listen.
We have to listen to our hearts.
We have to listen to our hearts. We have to listen to our body. You have to look yourself in the mirror every day and say, do I look fit or do I not look fit? And we have to exercise on a regular basis.
Yes.
That's the most important message you can get. And there are also studies showing that it's leisure time activity that's important. It's not the amount of activity that you have during your daily work that's important.
So we should take the stairs at work.
We should take the stairs at work, of course, but it's what you do once you get back home that's important. It's no good excuse to say, yeah, but you know, I walked a lot during my, or I think I exercised a lot at work, and then as soon as you get home, you are stuck on the couch in front of the television. That doesn't really help you. It's leisure time activity that's important as well to maintain your cardiorespiratory fitness.
We at least have very much and better opportunities to be active while off than on at work, such as, for example, very sedentary work as we all have today, being seated. We thank you, Peter, for your time today and for sharing these insights. I just want to take a quick dive into the comments, and there is a question out there. How many participants are the current algorithm based on?
Well, the current algorithm have included studies from across Denmark and across UK and Germany, and I don't have the exact number in my head at the moment, but it's been trained in a training set and tested in a kit for accuracy.
Yes, all right. So I hope, Søren, that partially answers your question, and we will of course be more than happy to get back to you at a later stage. We just want to round off today's webinar with the invitation to, if you have any further questions or comments, that we will be monitoring the comment section below in the time after this broadcast. If you want to meet either with myself or with any other from the team, you can book us directly via this QR code that is on your screen right now. And if you wish to have the slides that we have shared with you today, please write yes in the comment section below, and we will be sure to send you the PDF with today's slides, including the links to the medical studies that Peter has been sharing with us today.
Thank you. And then one last comment on the question from Søren. All of the testing of the SeismoFit device was obviously, it was tested against CPAP. So it was not tested against anything else. So it was tested against the gold standard.
Yes.
And there has a MAPE that's only a few percentage poorer than the CPAP test itself.
Yes.
That's an important point because most of the other stuff have never really been tested against CPAP.
And there's another question just here at the very end. What about obesity, obese patients when they put this?
Yeah, we have. You know, I can't share all of the data with you because the study is not published yet.
All right.
Yep. So, but I can tell you that there has been conducted a study in obese patients where SeismoFit performs as well as CPAP, maybe with the restriction of patients with a BMI way above 50.
Okay.
But so we pretty much cover a fair amount of all BMI patients.
Thank you, Peter. And thank you for all your questions out there. We thank you for your attention, and we wish you a great day. Bye for now.
Bye for now.